Hello everyone, myself Dr. Drishtija. Welcome to Dentospedia. It is one of the trusted platform for dental board examination preparation. And from today, we will be starting with a mini series from our pharmacology module, where I will be explaining you the most important topics of pharmacology in a very brief way. So let's start with our first topic, that is medical emergencies. So medical emergencies are rare but possible in the dental practice. Okay. And early recognition with timely management is very vital to prevent severe outcomes. Dentists should be trained in emergency drug administration, maintain readily available emergency kits, and regularly update their BLS, that is the basic life support, and ACLS, that is the advanced cardiovascular life support. Okay. To skills to ensure patient safety. Okay, so this is very important. We must know it. Now, the three cornerstone drugs that must be available in every dental clinic, it's very much important according to your examination point of view and also according to the clinical point of view. Now, first is epinephrine for anaphylaxis, asthma, cardiac arrest. Second is glucose for hypoglycemia, oxygen for almost all emergencies. So these three are the major ones, and other drugs are also there. Now, emergency scenario in dentistry. Medical emergencies in dental practice are uncommon but can occur abruptly, particularly in anxious and medically compromised patients. Conditions like syncope, anaphylaxis, hypoglycemia, asthma, angina, seizures, cardiac arrest requires rapid recognition, a calm response, and a timely drug administration. Understanding common triggers and first-line emergency drugs is very much essential for effective and life-saving management in the dental setting. So anaphylaxis, you must be knowing it is a IgE hypersensitivity reaction. It is a life threatening condition. Hypoglycemia, low blood sugar levels, and asthma is the bronchospasm. It is triggered by bronchospasm. Wheezing noise has been seen. Angina, it is due to the chest pain, and also because of the ischemia occurs in the heart muscles. And seizures, it's basically a brain disorder. Various types of seizure are there: tonic-clonic seizure, generalized seizure. Cardiac arrest is the stopping of the heart. Basically, heart is not able to pump blood, so it is also one of the life-threatening conditions. Syncope is the transient loss of unconsciousness due to various factors like anxiety, stress, pressure, high pressure also. So these are some of the very much important medical emergency, and in the management we will be dealing in the further slide. Now, the conditions that are most common in our dental office is vasovagal syncope. Example of the triggers are the anxiety and the pain, and primary drug, this is very important, is oxygen and ammonia. Ammonia is basically a respiratory stimulant. Okay. So it is not generally used in syncope, because syncope is basically due to it is a transient loss of unconsciousness of a patient, and it is basically due to when there is decrease in venous return to the brain. So when we put the patient in triangular position, that is the supine position and leg elevated, there is the venous flow to the brain, and patient subsequently also responds. So we don't use ammonia, but you should know that ammonia is one of the thing that is a respiratory stimulant. If the patient doesn't respond even after the position that we have put in, Trendelenburg position, then you need to give ammonia to that patient. Ammonia basically inhaler. Okay. And hypoglycemia, missed meal in a diabetic patient, very much common. So oral glucose should be given, dextrose also given in unconscious patient. Asthmic attack, stress and allergen, common triggers. Salbutamol, beta 2 agonist, and also epinephrine can also be given if you suspect that asthma has led to anaphylaxis. And anaphylaxis, it can be due to latex penicillin allergy. It is basically an allergy condition. So you will give epinephrine, very much important first line treatment. And angina or MI, if you suspect, it can be due to stress and exertion. Nitroglycerin, we have studied in the last previous lectures, sublingual route of nitroglycerin is given, oxygen can be given. Seizures, it can be due to epilepsy. Midazolam can be given. Diazepam can also be given. Oxygen, first diazepam, then also midazolam can be given. Cardiac arrest, it can be due to severe MI, because MI can lead to cardiac arrest if not treated in a particular time. Severe anaphylaxis can also lead to cardiac arrest. So epinephrine, CPR, cardiopulmonary resuscitation, you had to perform. Oxygen and immediate emergency medical services. So these are some of the conditions that you need to know. Now, first is the epinephrine, also known as adrenaline. Okay. So the indication is the anaphylactic shock, very important. Severe asthma attack, because it will lead to anaphylactic shock, cardiac arrest, and severe hypotension. Okay. So these are some of the condition, and because it is a vasoconstrictor, so it will have increased BP, so you can give it in the severe hypertension. Mechanism of action: epinephrine is a non-selective adrenergic agonist. We have studied in the ENS chapter. Non-selective, it has function on all the all the four receptors. So beta 1 stimulation, vasoconstriction will be there, that is increase in BP will be seen. Beta alpha 1, sorry, then beta 1 stimulation, it will have increase in heart and cardiac output. Beta 2 stimulation, bronchodilation will be seen. We have learned the mnemonic ABCD, if you remember: alpha for vasoconstriction or bronchoconstriction, beta for bronchodilation. So mainly these three effects are very much concerned to us. Now dosage, very important MCQ. You need to remember the dosage of all the drug that we will be studying in this chapter. Now, for anaphylaxis for adult, you will be giving 0.3 to 0.5 mg IM intramuscular. So this is also important, the route we will give in IM. Okay. And in child, you will give 0.01 mg per kg IM. Max, you can give 0.3 mg. And repeat after 5 to 15 minutes as needed if the patient is improving. Now, cardiac arrest, you have to give 1 mg IV every 3 to 5 minutes during the CPR. While you will performing the CPR, you need to give 1 mg IV every 3 to 5 minutes. Okay. So one thing to remember is generally we give IM route, the epinephrine for anaphylaxis. But if you suspect there is anaphylaxis, severe form of anaphylaxis is there, and so you can give it IV also. So IV is generally, I have told you in the previous lectures also, it is generally given for emergency situation. Otherwise, for exam point of view and also for your general point of view, IM is the basic route for anaphylaxis. And for cardiac arrest, it is IV. Now, formulation: preloaded auto injectors is there. EpiPen, for example, 1 is to 1000. This is also very important. The ratio MCQ can be asked from it. 1 mg per ml for IM use, and 1 is to 10,000. That is 0.1 mg per ml for IV in cardiac arrest. This is also important. Now, what can be the side effects? Because it is a vasoconstrictor, it can have palpitation because it stimulates the beta 1 receptor, and it can also have tremors. Hypertension can be there because it is a vasoconstrictor. Arrhythmias can also be there. So these are some of the side effects. So thank you so much for watching. I hope you liked the video, and please download our app Dentospedia for more structured and curated module for pharmacology. Not only pharmacology, every subject you will be getting here in a very structured format, from video lectures to quizzes to mock tests to everything that you need for your examination that will ace your preparation. So thank you so much and happy learning.